Good day, I'm Dr. Ebony Lambito Alisa Devesa, and now I will be discussing generalized anxiety disorder because one of you actually suggested this topic, and this is actually one of the common disorder in the anxiety disorders. So I have actually discussed in my previous videos about anxiety disorders, but I haven't dwelled much regarding generalized anxiety disorder. I also have prepared for you panic disorder with panic attacks. So, we will continue. Anxiety disorder is one of the common mental disorders aside from depression. And actually, anxiety can also be part of depressive disorder because in generalized anxiety disorders also have comorbidities like social phobia, specific phobia, depressive disorders, and other mental disorders. So generalized anxiety disorders can be part of those mental disorders. So that's why it's most common mental disorders, not only in the Philippines but also in the world. Okay, so generalized anxiety disorder is most common among women according to the statistics and the studies, though in the hospital setting with regards to admissions, there is actually equal ratio of men and women with regards to anxiety disorders. So what is anxiety disorder, specifically generalized anxiety disorder? There is a diagnostic criteria based on the DSM-5, which is Diagnostic Statistical Manual of the Psychiatry. Okay, so one of the criteria is excessive anxiety or worry most of the days for at least 6 months. So that's 6 months of worrying and apprehensive expectations of things about different kind of activities or events. It may be work related or school related or relationship, etc. Okay, and this worry is actually difficult to control. So if we ask patients how can you control those worries, if ever, can you be more focused on the present and not dwell on the future? So these patients would actually confirm that there is actually difficulty of controlling these worries. That's why it's actually called disorder. So aside from that, one of the criteria is to have at least 3 symptoms out of these 6 symptoms that I will mention. I prepared an acronym for these 6 symptoms, which is B dreams. So B is being easily fatigued. Okay, being easily fatigued. D is for difficulty concentrating or your mind going blank. Okay, so DR for restlessness or difficulty to relax. Okay, you're always stressed, you have difficulty to relax. I for irritability, dreams. So M for muscle tension, it can be aches and pains. And S for sleep disturbance, there are actually reasons for sleep disturbance. It may be sleep disturbance due to difficulty staying asleep or difficulty falling asleep, or after sleeping, like for example 6 to 8 hours, you actually have enough sleep but you feel stressed after waking up. So the sleep is not restful. So that's it. So that's at least 3 of those 6 symptoms that I mentioned. So I have actually prepared those acronyms for you to have to remember it easily. So those actually symptoms can be a disorder if it actually interferes with your functionality, like your social relationships, your work, your school performance. It affects you. Okay, you have difficulty to function your daily activities of living. So you are always anxious, and some actually realize that if they are anxious, no, parang even though they have a lot of sleep, or there are times that they don't actually do anything. They don't actually do anything, or they don't have a lot of work on that day, but they feel very very stressed, and they feel very they feel tired, that they think they have done a lot of work. I mean, if you think about it, physical activities can be tiring, but after resting for about a few minutes or an hour, you feel relaxed, you feel better, or after sleeping, you feel good. But if you are actually, that means if you are emotionally stressed, then that's a very difficult thing, because even though you have sleep well, or you have a lot of sleep, you still feel stressed and you are not relaxed. So mahirap siya. Mahirap siya na mag-relax if stressed ka. Actually, I have a lot of alternative therapies that you can use in order to relieve your stress. So I have discussed their stress management in my previous videos. Emotional freedom technique that you can use in order to relieve your stress. Breathing meditation. And I also have prepared music for the brain. Listen for that music for the brain. Listen for that relaxing sounds of nature that can make you relax. Okay, so those are the criteria. But take note also that those criteria must be met, as well as there is no substance use. So dapat no use of prohibited drugs like marijuana, shabu. Okay, it can also cause anxiety. Other than anxiety, it can cause psychosis and other mental disorders. So aside from that, there can also be medical conditions that can cause anxiety. So one of those medical conditions that we rule out, that's why nagpapa-request kami, TSH, T3, T4, usually those are thyroid panels, in order to rule out thyroid problems. Specifically for anxiety, that's hyperthyroidism. Okay, that's why kung magtatanong kayo, bakit nagpapa-request si Doc ng ganitong mga laboratories? Because there is actually a rationale behind that. Okay, anxiety can also be part of medical conditions. And anxiety can also be part of other substances that can cause those anxieties, no? So, I have mentioned those. So, pag ganon, pag sure ka na hindi siya medical condition yung cause, and syempre, pag sure yung doctor mo or yung professional, yung nag-ask ka ng professional help and those were requested, pag normal yung mga request na yon, and nagpa-drug test, normal din ang mga lab for out of those substance, no? Magko-consider talaga yung doctor mo generalized anxiety disorder. Especially na kapag normal din yung mga laboratories mo. Normal yung vital signs mo, yung heart rate mo, blood pressure mo, normal yung mga temperature, respiratory rate, yung O2 saturations, yung ECG mo, yung minsan kasi yung namamanifest yung anxiety, palpitations, ganun. So, normal yung ECG mo. Tapos, normal din yung mga, yung ECG is electrocardiogram. So, graph yung yung piece of paper niya yun at ini-interpret ng doctor, no? Tapos yung dapat ma-rule out din na may, if ever, may mga medical, psychiatric disorders na pwedeng anxiety is under those disorders. Like for example, pwede din kasing mag-anxious ka pero may depression ka talaga, okay? So, part nung depression, merong anxiety. Ganon, yung mga anxiety features under major depressive disorder. So, yon, okay? So, what can be the causes of this anxiety? Actually, biologically or pwede kasi siya na hereditary. Pag nagtatanong kami sa mga pasyente sa family history, sino ba sa pamilya nyo yung may nervyos, no? yung mga anxiety, no, na kinakabahan, yung parang hindi mapakali, mga ganun. Usually, meron kasing family or relative na may anxiety disorder, pero pwede din na hindi lang siya na-diagnose. Kasi pag mild anxiety kasi siya, na yung effect niya sa functionality mo is mild din, then you can actually, others just tolerate those anxiety, no? But if it's moderate to severe, then yun yung problem. Yung nag-aas na yung health, yung mga patients or persons with anxiety disorders. Okay, then we start medications. Your biologically, merong mga neurotransmitters or chemical imbalance na pwedeng mag-cause ng anxiety. So, most commonly, for anxieties, pwede din siyang neurotransmitters na imbalance due to depression. So, mostly common siya, serotonin, norepinephrine, ganun, yung mga common na mga neurotransmitters. So, aside sa hereditary, biological, pwede din kasi nasa social theory, no, if anxious yung parents, napapasa siya. So, kung minsan, pag nakikita namin yung mga bata or if there is a consult for children na parang anxious sila, tinitingnan namin yung parents. Kapag anxious yung parents, mostly doon nanggagaling yung anxiety din ng bata. Okay? That's why it's very important for parents to be calm as well, or if ever, if meron talaga silang anxiety disorders then they really need to ask professional help. Okay? So aside from treating those children, kailangang matreat namin yung parents. Kasi it's useless na yung children ititreat tapos yung nagkakos, yung mga parents, hindi siya matreat. So ano lang, imbis na mawala yung cause, then parang continuous lang. Kasi yung treatment for anxiety, mostly medications kami and therapy. So medications, for example, SSRI, so selective serotonin reuptake inhibitor. So usually commonly binibigay namin escitalopram, yung makakatolerate ng other medications like fluoxetine, sertraline, so okay. And aside from that, if nahihirapang mag-sleep, we give benzodiazepines or at times antihistamines if mas makaya nilang makatulog through antihistamines like diphenhydramine. So okay yon. So aside from that, studies shows na effective din yung cognitive behavioral therapy. So, aalamin namin yung usually yung thinking patterns, bakit ganun, bakit nagko-cause siya ng anxiety, ano yung, paano siya mag-isip, paano yung mga automatic thoughts niya nag-affect sa emotions niya and behavior niya. So, cognitive behavioral therapy usually 12 sessions siya, but depending on the situation, but usually yun, 12 sessions siya. And pag na-relieve na kasi yung anxiety, so go on na with treatment of anxiety. But tatitrate na namin, magdi-decrease na kami sa medications once okay na yung effect ng therapy to those patients. Okay? So yun I think yung mga importante na malaman nyo, and you have to consider that when you have those anxiety disorders, or if you know someone who have anxiety disorders. So, minsan kasi, we think anxiety is, it's okay lang, unless if nag-interfere na siya sa work mo or relationship. But anxiety is actually, mayroon tayong tinatawag na normal anxiety, no? Pag kumukuha tayo ng exam, if you're taking exams, or mag-present ka for any presentations, marketing man yan, or any activity sa work, no? So, yun. So, normal anxiety. Unless, yun, pag na-fulfill niya yung criteria na na-mention ko kanina with regards to generalized anxiety disorder according to the criteria of DSM-5. So, pag na-fulfill yan, so generalized anxiety disorder, then we go to the management, which is medication and the therapy. So, usually, pag generalized anxiety, medyo long-term yung treatment, So, if you learned something from this video about generalized anxiety disorder, You may want to comment for another video about any mental disorders that you want to learn more, or comment anything. If you appreciate this video, please share, and please help me reach more people by subscribing and helping them subscribe as well. Thank you and God bless.